We talked to people who stutter, speech language pathologists, and read the research to understand stuttering. This is an important message about this video that you should take a moment to read. Let's start with what is stuttering. At its simplest definition, stuttering is a fluency disorder. Check out our video called What is Stuttering for a more detailed definition. Let's talk about some signs of stuttering. There are different types of disfluencies. Disfluencies are when we repeat parts of what we're trying to say, when sounds get stretched out, or when the air gets stuck. It's important to know that we all have disfluencies in our speech from time to time. People who stutter generally have more frequent disfluencies that affect the smoothness and forward movement of their speech. There may be tension or behaviors involved in stuttering. This could prevent speech or might also be secondary to speech. It includes things like physical tension, such as clenching muscles of the face, or behaviors like blinking. Stuttering can cause changes in the speaker's pitch and loudness, which is usually related to the tension in breathing and speaking muscles. Stuttering can cause words to sound broken up or choppy. Sometimes when people stutter, they can also speak really quickly and sound rushed. People who stutter often describe their speech as becoming stuck or not moving forward. Finally, there can be negative feelings or attitudes about speaking that are a part of stuttering for some people. These feelings and attitudes can affect how much that person stutters, who they talk to, and even impact what they say. It's important to remember that stuttering is way more than the disfluencies that we hear. Treatment might target disfluencies, behaviors, or any other of these signs. It's helpful to know some of the basic facts about stuttering to best understand it. Let's talk about 4. Stuttering is cyclical and changing. This means that people who stutter go through times where they stutter a lot and times where their stuttering is less. You might notice changes depending on the environment, time of day, or who they're speaking to. Stuttering is a relapse-prone disorder. This means it's likely to come back if the techniques are not continued or practiced. When we plan therapy, we want to build new speech skills, but we also want to have a plan to continue to work on skills long after the formal therapy sessions are completed. Stuttering generally develops between the ages of 2 and 5 years old and tends to impact biological males at a higher rate than females. Stuttering can be developmental, meaning some children outgrow stuttering when they're preschoolers. Between 75 and 80% of all preschoolers will recover. So, what causes stuttering? We don't know specifically, but we do know that stuttering is the result of an unstable speech motor system where there's difficulty with timing and coordination. We also know that parents do not cause stuttering, and there are several risk factors for ongoing stuttering. Stuttering tends to run in families, and having a close family member who stutters is a risk for ongoing stuttering. Children who begin stuttering after 3.5 years of age are a greater risk for ongoing stuttering. Other areas of development, like speech and language skills, are a third risk factor. For example, children who have a more advanced language system compared to the speech muscle control are more likely to stutter. We also want to think about personality factors. Personality, tendencies, or reactions can contribute to ongoing stuttering. And our final risk factor is time. Children who have been stuttering for more than 6 months are at a greater risk for ongoing stuttering. Now, we couldn't really understand stuttering without talking about awareness and impact. Awareness and impact of stuttering is individualized and is really important when assessing and planning for therapy. People who stutter have different levels of awareness. In general, young children do not show awareness of stuttering. Some older children and youth may have a very clear awareness of their stutter and have developed fears, feelings, or attitudes related to speaking. Awareness can tie into impact. Some people are really impacted by stuttering and it affects their day to day life and relationships. Other times, there's little impact, or stuttering can be really positive for people. For some, stuttering is just a part of how they talk and who they are. Now, we've talked a lot about stuttering. Let's review what stuttering is not. Stuttering is not caused by family or caused by anyone. Stuttering cannot be learned, and even though family history is a risk factor, genetics alone do not cause somebody to stutter. Stuttering is not a psychological problem. It doesn't happen because someone is anxious, shy, nervous, or depressed. And stuttering is not a sign of low intelligence and has nothing to do with how smart someone is. As a speech language pathologist, a question I'm asked a lot is, should I worry about stuttering? The answer is, it depends. What's important to know is stuttering is more than what we hear. It's different for everybody, and it can be influenced and improved by therapy. So, what should you do when someone stutters? Here are two things you can try. The first is slowing down. Slow down your own talking rate in a way that sounds natural but makes it clear that you're not in a rush. Listen to me do it. To help you slow your speech, try to imagine that someone is writing down everything you say. Speak in a slow, calm way. Slowing down shows others how to speak in a natural, unrushed way and also allows the person more time to take a turn and talk without being rushed. The next is to listen, really listen. Be patient and let that person finish what they have to say. Don't interrupt, speak for them, finish their sentences, or rush them. Be a good listener. Listen to what they have to say and not how they're saying it. I hope you have a really good understanding of stuttering now. Thanks for watching.